When we talk about reflux disease, we actually have a list of the typical symptoms and the list of atypical symptoms. And sometimes we even have patients that come in and they didn't realize that they were having reflux disease.
I had no symptoms whatsoever. The only reason they found out that I had it was because I had entered my 50s and it was time to get a colonoscopy. At that time, I decided to have both done, the endoscopy and the colonoscopy. That's how they found it, and I was totally shocked because I had no idea that I even had it.
We have a lot of people that don't realize that they have reflux disease, and it takes a little bit before they come to the realization that, this is the entity that they're dealing with. And that's very important because having the right diagnosis is going to lead to the right treatment.
I had asked Dr. Ihde to explain it to me because I couldn't quite understand, exactly what he was going to be doing. So now, with this surgery, I stand a great chance of living a normal life and eating what I want to eat.
First, we went in with little incisions and we were able to free up the stomach, close the diaphragm down to the right size. And then we used the newer procedure to create the valve to close off the esophagus so that she wouldn't have reflux. And that involves going down through the mouth into the stomach. We attach to the end of the esophagus, and then we fold the top part of the stomach, what we call the fundus, back onto the esophagus. And that creates sort of a flap valve. As the stomach expands, push the front wall of the esophagus against the back wall, closing it off so that the content in the stomach doesn't get into the esophagus, which is what reflux is. 2 weeks after surgery, her symptoms have been resolved. She's off of her medications and is working towards getting back to a normal diet. So she's very happy with the procedure, and I think it's a testament to the way the procedure works.
Just to know that he took care of that problem for me, and my stomach will open and close, when I eat, my chances of living a longer life are so much greater.